Inside the human body, an invisible war is constantly being fought, a silent, relentless battle between the intricate order of healthy cells and the chaos of disease. For generations, humanity has sought powerful weapons for this fight. Today, one of our most profound allies is something we cannot see, touch, or hear, a fundamental force of the universe, harnessed with incredible precision: radiation. The term itself can sound intense, even frightening, conjuring images of uncontrolled power. But the reality of medical radiation therapy is a story of control, of physics guided by compassion, and of a calm, step-by-step process designed to heal. So let's explore what actually happens, why it's used, and how this powerful tool is made safe and effective. Medical radiation therapy is a highly targeted treatment that uses beams of high energy to damage and destroy cancer cells. Its primary weapon is focused energy, which disrupts the very blueprint of these malignant cells, their DNA. Unlike surgery, it doesn't involve a single incision. Unlike many systemic drugs that circulate throughout the entire body, radiation can be sculpted and aimed with millimeter accuracy. It is a discipline where medicine meets physics, allowing doctors to target disease with a precision that was once the realm of science fiction. The goals are tailored to each individual. For some, the aim is a cure, to completely eradicate a tumor. For others, it's used to shrink a tumor before surgery, making it easier to remove. It can also be used after surgery to eliminate any microscopic cancer cells left behind, reducing the risk of recurrence, and in advanced cases, it provides profound palliative relief, easing symptoms like pain and improving quality of life. At its core, radiation therapy is a masterful application of physics. The radiation used, typically high-energy X-rays, gamma rays, or charged particles like electrons and protons, carries energy across space. Quantum mechanics teaches us that these fundamental components of our universe exhibit a strange and beautiful duality, behaving as both waves and particles. This allows them to deliver their energy in precise, measurable packets called quanta. When one of these energy packets strikes a molecule within a cell, particularly a DNA molecule, it can transfer enough energy to break the chemical bonds that hold it together. This process, called ionization, creates a cascade of biological effects. It is this fundamental interaction, energy-altering matter at the atomic level, that forms the scientific foundation of radiation therapy. A team of physicists, dosimetrists, and physicians work together to calculate exactly how much energy is needed and how to deliver it to achieve a therapeutic effect while protecting the patient. So how does this energy specifically target cancer? The answer lies in a key vulnerability of cancer cells: their relentless, rapid division. This constant state of replication makes their DNA particularly susceptible to damage. Radiation therapy exploits this weakness. The high-energy beams create breaks in the DNA strands. While a cell can sometimes repair a single-strand break, the intense energy from a therapeutic dose often causes multiple double-strand breaks, damage that is far more difficult for a cell to mend. When a cancer cell with this level of severe, irreparable DNA damage attempts to divide, it fails. This catastrophic failure triggers a natural, self-destruct sequence called apoptosis, or programmed cell death. The cancer cell effectively dismantles itself from the inside out. Healthy, normal cells, which divide much more slowly and have more robust and efficient DNA repair mechanisms, are better equipped to handle radiation. They can often pause, repair the damage, and continue their normal function. This crucial biological difference, the cancer cell's reckless growth versus the healthy cell's resilience, is the therapeutic window that allows radiation to be a life-saving treatment. To leverage this principle, clinicians have developed several sophisticated methods of delivery, each chosen with mathematical precision to fit the patient's specific cancer type, size, and location. The most common form is external beam radiation therapy, or EBRT. Here, a machine called a linear accelerator, or LINAC, located outside the body, generates high-energy X-rays and directs them at the tumor from multiple angles. A specialized form of EBRT is proton therapy. Protons are charged particles that have a unique physical property. They deposit the vast majority of their energy at a specific depth and then stop. This phenomenon, known as the Bragg peak, allows doctors to deliver a powerful dose directly to the tumor, with virtually no exit dose, significantly reducing radiation exposure to healthy tissues beyond it. A second major category is brachytherapy, which means short-distance therapy. In this technique, tiny sealed radioactive sources are placed directly inside or next to the tumor. This can involve temporary placement of sources for a short time, or the permanent implantation of tiny radioactive seeds that deliver their dose over weeks or months before becoming inert. Finally, there is systemic radiation therapy. This involves radioactive medicines, or radiopharmaceuticals, that are swallowed or injected. These smart drugs are designed to travel through the bloodstream and seek out cancer cells throughout the body, like the well-known use of radioactive iodine, I-131, which naturally accumulates in thyroid cells to treat thyroid cancer. The journey to treatment is a testament to modern precision medicine, where technology and human expertise converge. It begins with a detailed consultation where you and your radiation oncologist discuss the goals, benefits, and potential risks. This is followed by a critical planning session called a simulation. Here, you'll have a CT scan in the exact position you'll be in for treatment. To ensure you remain perfectly still during each session, a custom immobilization device, like a soft mask or a body mold, is created just for you. Tiny, permanent ink marks or temporary marks may be placed on your skin to serve as precise coordinates for daily alignment. Behind the scenes, this is where artificial intelligence and advanced software play a transformative role. The team of physicists and dosimetrists uses your CT images to create a detailed 3D map of the tumor and all the surrounding healthy organs. They then run complex calculations to design the optimal treatment plan, determining the precise dose, the number of beams, and their angles. Technologies like intensity-modulated radiation therapy, or IMRT, allow the team to paint the dose onto the tumor, using thousands of tiny, computer-controlled beamlets of varying intensities. This sculpts the radiation to conform to the tumor's exact shape, protecting nearby healthy tissue like never before. This entire process transforms raw physics into a highly personalized, life-saving medicine. Radiation therapy is powerful, and because it works by affecting cells, it can have side effects. However, these effects are carefully managed and are almost always temporary. The type and severity depend entirely on the area being treated and the total dose. The most common short-term side effect is fatigue, a feeling of tiredness that builds during treatment and gradually subsides after it's complete. Skin changes in the treated area, such as redness or sensitivity, similar to a sunburn, are also common. Your care team will provide specific guidance on how to care for your skin. Long-term risks are rare and depend on which healthy organs are near the radiation field. Your oncology team meticulously plans your treatment to keep the dose to these organs well below established safety limits. It's also important to address a common concern: radioactivity. For patients receiving external beam therapy, you are not radioactive. You can safely be around anyone, including children and pregnant women, immediately after your session. For certain types of brachytherapy or systemic treatments, you may need to follow temporary safety precautions for a short period. Your team will provide clear, detailed instructions on everything you need to know. Throughout your treatment, you'll have weekly check-in visits with your doctor and nurse to monitor your progress, manage any side effects, and ensure you feel supported every step of the way. There is a profound and beautiful connection to be made here. The very same type of energy that we harness in the clinic is born in the hearts of stars and released in the spectacular death of supernovae. The universe is awash in radiation. It is the energy that streams from our sun, that travels across galaxies as cosmic rays, and that shaped the cosmos in the moments after the Big Bang. Through the ingenuity of science and medicine, we have learned to understand, to control, and to repurpose this fundamental cosmic force. What once shaped the universe on a galactic scale now helps heal the human body on a cellular one. Science connects the cosmos to the clinic, turning a force of nature into an instrument of hope. And the journey of innovation is far from over. The future of radiation therapy promises even greater precision and fewer side effects. Researchers are exploring flash therapy, which delivers radiation at ultra-high dose rates, potentially sparing even more healthy tissue. Adaptive planning, powered by AI, will allow treatments to be adjusted daily in response to how a tumor is shrinking. New radiopharmaceuticals are being developed to act as theranostic agents, combining diagnosis and therapy in a single molecule. We are standing at the intersection of physics, biology, and human hope. If radiation therapy is part of your care plan, don't hesitate to ask your team questions. Ask about the goals of your treatment, the schedule, the expected effects, and who to call with concerns. Understanding the plan, the science, and the team supporting you is the first step in turning a scary word into a clear, manageable, and hopeful path forward.